Hi guys. So I just wanted to update that all the video that I uploaded to YouTube, it's not part of my university assignment. It's just my hobby, and it's based on the what I learned from university. So if you find alternative way of explaining or describing each definition or something else about the topic, please don't mind because these are based on my research. And so all the best for your nursing education and best wish, and please enjoy the video. Hi, I'm still student nurse. Welcome back to my channel. So today we start talk about prostate cancer. So before we begin, I'd like to explain why it's important to know prostate cancer topic. At least 1 in 5 men is likely to diagnose with prostate cancer by the age of 85, and approximately 28,868 cases in Australia since 2025. And there's no vaccination against prostate cancer. So understanding this topic will be helps patients and all learners to prevent chronic illnesses, improve their health quality, their reproductive health quality, to seek intervention and screening on time. And you can also refer back to this video to rewatch each section at your own pace. So the purpose of this presentation aim to disseminate nursing practice to consumer to understand preventative cares, the definition, the causes of prostate cancer, the symptoms, the risk factor, and pathophysiologies, what are the diagnosis, the treatment against prostate cancer. According to the Cancer Council, Australia, the definition of prostate cancer defined as the abnormal growth of prostate malignant tumor cell growing from walnut size and enlarging into uncontrollable size inside the prostate's peripheral zones of male's reproductive system. It's also happened if there's a person with prostate glands, they also experience prostate cancer at any times. It's not just male. Um, the problem is the cancer spreads to lymph nodes, visceral organs, causing urination difficulty, incontinence with blood sometimes, and life-threatening episode when urethral compression. So what is the etiology or the cause of prostate cancer? The etiology of prostate cancer involves genetic mutation, hormonal dysfunction, high toxic dioxins diet with high vitamin A, and infection factors, usually with detection of a lump or the prostate gland's enlargement. Age increasing causes genetic mutation when DNA got damaged or inherited genes born with high risk of cancer. In this case, example of African American descendant male, they were born with high risk of prostate cancer. Prostate-specific antigen or PSA level is higher than 3 nanogram per milliliter, and the Gleason score after the biopsy above 5, indicating prostate cancer. However, high PSA alone cannot conclude as having prostate cancer unless they are immunocompromised or they have family history of cancer. And idiopathic carcinogen effect includes tobacco smoking or illicit drug uses, obesity, radiation exposure, like excessive from X-ray or UV radiation, viral infection like hepatitis or E. coli and other viruses, comorbid to the factor influencing prostate cancer as well. So what are the symptoms of prostate cancer? The symptoms include abdominal pain, incontinence, bladder spasm, urethral irritation, leakages, hot flush, dyspepsia, loss of libido, erectile dysfunction, incomplete micturition dribble, urinary blockage, intermittent bloody urination, and high frequency. What are the risk factors of prostate cancer? There are modifiable and unmodifiable risk. Modifiable risk factor can be changed, include plenty caffeine intake, so reduce caffeine, excessive radiation exposure, prolonging intensive cycling hobby if after diagnosis and the cancer revealed. So reduce cycling hobby or intense physical workout. Misuse of medication also part of risk factor influencing the cancer and hormone injection therapy. Unmodifiable risk factor include age factor. Because of the age factor, it's affect gene mutation. That's when the DNA got damaged and prone to develop cancer. And then family history of having cancer, inherited gene born with susceptible risk of cancer. Example, African American descendant. So what is the pathophysiology of prostate cancer? The pathophysiology of prostate cancer develops when the alteration of p53 protein transfection system deactivate apoptosis in the prostate gland's peripheral zone. That's when inflammatory cells ingest basal cells, creating prostatic intraepithelial neoplasia and damages to the DNA, where gene mutation and bone metastasis. So then cellular stress, it triggers genomic instability and fibroblasts causing alteration to AKT kinase signal, then activate gene mutation of androgen independent receptor, the AR receptor, on the X chromosomes of males. Then it results in androgen independent diseases develop into prostate malignant metastasis. So p53 proteins, it's a type of protein that have repair and grow the DNA. It prevents in genetic mutation. So in this case, in apoptosis, it have grow and repair the DNA, inhibited genetic mutation. Apoptosis means the cell that's programmed. So androgen hormone, it functions like a paracrine hormone for sperm production. So it's synthesized by intraprostatic conversion of the testosterone hormone to dihydrotestosterone. Then it activates androgen receptor or AR receptor. Then it enlarges the malignant tumor cell and metastasize or spread to lymph node, pelvic limb, seminal vesicle, bladder neck, and prostate glands. Basically, if we think about the hormone related to the cancer, the lower testosterone, the higher chance of cancer. So what are the diagnoses of prostate cancer? The diagnosis of prostate cancer can be done through prostate-specific antigen, PSA blood testing, and prostate biopsy. PSA blood testing to observe the PSA level in the blood to aim for less than 3 nanogram per milliliter to be considered as normal. And prostate biopsy is a prostate-like culture to put it into a microscope examination to observe the Gleason score. And the Gleason score should be less than 5 to be considered as normal. And otherwise, the abnormal result or higher than these data, it can develop into cancer or locally advanced. And then the next diagnosis can be done through digital rectal examination, the DRE, to palpate the rectum to observe prostate size, firmness, and nodules. For this case, X-ray or ultrasound or MRI imaging is not recommended or not highly recommended for diagnosis of prostate cancer because it can cause radiation exposure. So what are the treatments for prostate cancer? The treatment for prostate cancer includes androgen deprivation therapy, medication, and surgeries. In this case, androgen deprivation therapy uses anti-androgen hormone medication to suppress, delay, inhibit the growth of androgen hormone, and delay onset of cancer metastasis. For medication, I cannot explain the specific generic name in this presentation. Also, there's so many types of medication for initial treatment for prostate cancer according to the pharmacist and the doctor. So these are only available if you send message to me asking why you want to know the specific generic name of the medication. And the surgery, I will discuss about one specific surgery, but there's two types, the retropubic radical prostatectomy and the robotic laparoscopic prostatectomy. So I will discuss about retropubic radical prostatectomy. It's a surgical procedure, remove the entire prostate gland, seminal vesicle, the bladder neck, the pelvic lymph nodes to treat prostate cancer. Usually one long cut of the abdomen incision to open. The surgery has higher susceptibility to iatrogenic infection from the equipment and the wound infection because of more blood transfusion and performed by the surgeon's hand. So patients may require blood product and stay sedation in post-anesthesia. For initial treatment, robotic-assisted laparoscopic surgery is another alternative, but using the robot to conduct the surgery for the patient, it provides better patient's health outcome compared to retropubic radical prostatectomy because laparoscopic surgery use minimum invasive procedure. It uses neurovascular bundle, less bleeding, and shorter duration of procedure and hospital stays. So what are the post-surgical expectations? Patient may wear elastic sock compression to prevent venous thrombus embolism, the VTE or blood clot, and they may wear diaper pads or nappy with for urination and with end-swelling urinary catheter, the IDC, inserting into the bladder to drain out urine and fluids. Patient may carry multiple ostomy drainage bags attached to the reproductive system. Multiple intravenous and insulin catheter remain in situ for medication. They may have gastro tubing for feeding or medication, if nothing by mouth. Usually nothing by mouth after the surgery. Wound scale or skin assessment, physical examination, blood glucose level, urinalysis, and vital sign were regularly conducted by the RN, so they may feel disturbing. Hair loss, infertility, and menopause are side effects from chemotherapy. Patient may stay sedation or nausea after imposed anesthesia. And they feel pain to abdominal pain, the bruises, incision pain, of irritation to the bladder. And bleedings may occur after bowel movement or coaching for recent surgery. At least 1 week of hospital stay and minimal remission period takes 6 weeks. So what are the preventative cares for prostate cancer? The diagnosed person might need to reduce caffeine intake, prolonged cycling hobby, or intense physical activity that can increase tensions to the reproductive system. For example, lifting heavy objects, it can increase androgen hormone during intensive workout. Some nutritions to avoid, including caffeine, high-fat red meats, and vitamin A. The person should replace their diet with vitamin E, selenium, tomato, pink grapefruits, watermelon with high lycopene, cruciform vegetables, and green tea to repair the DNA. Quit smoking and stop alcohol consumption is the best option to prevent further risk. Avoid holding urgent urination or having extreme spicy diets that can cause burn urination. Personally, hydration, physical with soaps. Encourage to have liberal fluid intake of 2 to 3 liters per day only to improve continence and urine flow, and always be protective with sexual behaviors. Physical activities include Kegel pelvic floor, muscle training, aerobic training, and bladder training only for those after underwent the surgery to improve their continence and bladder function. If the patient is feeling the sign or symptoms of urination difficulty, ensure they wear normal loose pants, avoiding wearing tight jeans or pants that can compress the urethra. Hygiene the inguinal area with antiseptic lotion or dermal cream to promote skin proliferation, and avoiding waxing or shaving near the urethra. Simply washing underwear with warm soapy water at least once per week or fortnightly, and dry clean without contamination. Always talk to your doctor and seek support services if feeling signs or symptoms or notice abnormalities. So these are all the preventative cares for prostate cancer, and references available upon request. Thank you for watching. If you like my channel, please like and subscribe to my channel for more, and see you in the next. Thank you so much. Bye.